Hello, my name is Jessica McGran, and I'm a program manager at the Child Neurology Foundation. You are about to watch a pediatrician and a parent role play a telehealth visit. It is our hope that this video provides you with some tips and strategies to implement in your next telehealth visit. What you're about to see is informed by the feedback CNF collected during the summer of 2021 from both parents and families, as well as providers and clinicians, about what makes for a good telehealth appointment for everyone involved. Today, we're joined by Dr. Sue Kressly and Ms. Amanda Jaksha. Dr. Kressly, will you introduce yourself?
Thanks for having me. Yes, I am a general pediatrician with over 30 years of experience in an independent, patient-centered, family-centered medical home. And I am always looking for innovative ways, including technology, to make sure that our patients and families are at the center of our care team.
That's great. Thanks so much. And Amanda, will you introduce yourself, please?
Yes, my name is Amanda Jaksha. I am mother to Ava, who is 16 and lives with CDKL5 deficiency disorder, as well as to Eliza, who is 12. And we are users of telehealth medicine on occasion, and happy to be here.
Great. We are happy to have you. Thank you. And with that, I'll let the two of you begin.
Hey, Amanda, thanks for connecting with us today. Oh, I see you're home and your dog is happy to see me. That's awesome. How are you doing today?
I am doing fantastic. As you can hear, my dog is really excited to see me. Give me just a moment.
No worries.
Thank you for being patient with me. We are excited to be trying to get to the bottom of what's going on with Ava today.
Yeah, and thanks so much for inviting me into your home. And on the last time we connected, I understand you were moving. You look pretty organized for a mom who's trying to move to a tween, a teenager, a dog, and a family full of stuff. Are there boxes hiding behind a window that you don't want me to see?
There are boxes hiding, but we'll navigate around them as we get through this telehealth visit.
And we so appreciate you connecting with us via telehealth so we can tackle Ava's acute problem. And again, are you in a good place? Does this feel like, other than the dog and kids interrupting us, I'm totally cool with that. You're okay where you are?
I'm okay. Cool. I've had a little bit of a rough connection, so I'm happy to connect closer to Ava on a cell phone if that's needed.
Yeah. So my team tells me that Ava's been having some belly pain. And right now, from my perspective, what I'm trying to get to in this telehealth visit, is this an urgent problem where I have to ruin your day and tell you to go to the emergency room, like a surgical emergency? Or is this something that we can take the time to explore and get to the bottom of? So if you wouldn't mind taking me with your cell phone to where Ava is, it will help me sort of walk through what I'm thinking. And I'm going to use you to play doctor on TV and do some exam elements that will help me get to a better understanding of what's happening. So
okay.
If you want to just disconnect here or put me on pause and pick up with your phone, that would be fabulous.
Fantastic. I'll be with you shortly.
Got it. Hey there. Okay. So what I'm going to want to do first is see Ava's face. If you wouldn't mind flipping your camera to include this. Hi, Ava.
Hi, Ava.
Hi. So
Dr.
actually,
Kressly.
yeah, hi. I'm actually gonna want to see her face, because what I'm looking for is her reaction when you touch her belly. So there are 4 areas of the belly. We call them quadrants. If you think of sort of a tic-tac-toe board, there's the right upper quadrant, the left upper quadrant, and the right and lower left quadrants. That's how in medicine we sort of define the parts of your belly. And what I'm worried about when somebody's got belly pain is if something hurts in the right lower quadrant, because that's where your appendix is. So I'm trying to decide, is this a kid with an appendicitis or not, right? And so I never start with the place that hurts, because once you did that, you lost your patient. But we're going to go to the opposite of the right lower quadrant. And if you could touch her belly at the left upper quarter. Hey, Ava, still doing okay? And then mom, just press down a little bit and then abruptly leave your hand off and let go.
Okay.
She looks like she doesn't care. Is that what you're getting out of this too?
Yep, that's
Cool.
what I'm getting.
Let's move to the right side. in the upper quadrant. Same thing, press down and then just abruptly let go. She looks like she doesn't care about that either. Hey, Ava. Awesome. And now we're going to the lower side, but we're going to go to the left first.
Okay.
For kids who are constipated, sometimes they hurt a little bit when you do that because that's your sort of last place that poop goes before it leaves. So if you can press down on that left lower and then let go. Hey, Ava, you look like you're still doing awesome. Cool. And then we're going to go to the target, which I really care about, which is the appendix site, which is your right lower quadrant. So if you could press on that right lower quadrant and then abruptly let go. You're all good, girlfriend. I think that we're not worried about an appendicitis here, Mom. So Mom, can I see your face again? Thanks, Ava. You were fab.
Sure.
Two things I want to just point out to you. One of which is when you press down, often kids are tender, but the appendix is a free floating organ. And so if you let go, it bounces. And if you have an inflamed appendix, kids do this, and I didn't see any of that. So if you're ever awake at 2 in the morning with your kid with belly pain and you're trying to decide if this is appendicitis, do what we just did and realize that when you let go, that makes them jump. You know that they may have an inflamed appendix. There's also another trick that you can try, and you can do this after we disconnect. And that is if you ask a kid to jump up and down on their right foot, they won't jump a second time. If you have an appendicitis, you jump and it does that same jostling of your appendix that hits the front of your belly wall and you go, no, thank you. Or kids will walk around and they won't even stand up. Those are really good clues for how to tell in the middle of the night or with a connection like this, is this a surgical emergency and I got to send you to the emergency room because I think your child has an appendicitis, or is this something that we have more time that we can figure out? So that's fabulous. If you want to leave Ava, go back to sleep or, do whatever she was doing, let's wrap this up. If you would join me back on your computer, that would be awesome.
Okay.
Thanks so much. And if you can just excuse me for a second, it's not that I'm not paying attention to you. I want to make sure that I'm writing the right notes in Ava's medical records so that if you call back in or what have you. And I really do think that today's visit was just about us trying to decide, is this a surgical emergency or not? I think that telehealth is one of those things where we can do this, but it has other uses. And I just want you to know that what I'd like you to do is I'm going to send you a portal message with a couple of other things to look at and look at her stool pattern and when this bothers her. Let's keep this conversation going via a portal messaging and then decide if we need to do additional lab work or bring her in for an in-person exam so I can actually see her belly and touch her and learn more.
Okay.
So thanks so much.
That sounds like a great plan.
Going further, clearly telehealth, we all sort of did more of this during the public health emergency, but I just want you to know that it's always an option, and our team will be honest with you about whether this is something we can accomplish via telehealth or whether it really needs an in-person visit, or whether we can start telehealth and then move to an in-person visit. Or sometimes it's totally fine to follow up after a visit or an interim visit with telehealth. And so what I'd like to empower you as a mom is please be honest with my care team, right? If we tell you, we can give you a 3 o'clock in-person visit, but you're like, I got to be home because my other one's getting off the bus, then tell us and say, is this appropriate for telehealth? As I said, my practice likes to be family-centered. And so tell us your preference. We'll be honest with you if we think it's not the most appropriate place for care. And I think the technology is going to change, right? A decade from now, you're going to be able to go, you want to hear her breathe? Right. And I can listen to things. We're not there yet, but I think telehealth is evolving. And as families and patients and healthcare providers, we have to figure this ongoing journey out together.
I appreciate that so much because it's not always easy to drop everything and come in for a tummy ache. And it's good to have this peace of mind that, something serious isn't going on that needs to be resolved today. So we really need that flexibility, and I will be sure to take advantage of that the next time I contact the team.
Great.
All right. Thank you both so much for that. I'd like to ask you both a few questions about your experiences, if that's okay. And Dr. Kressly, I noticed that you began the visit thanking the parent for welcoming you into their home. Can you tell me a little bit about why you made that choice and why you start your visits that way?
Well, I think first and foremost, we're about caring for people. And unless you make that connection as a human being, technology's the tool, but it's not the connection. And it's no different than if I saw somebody in my office and I happened to say, notice something, or I knew you were moving and asked you how you're doing with that, or said to a child, like, you look awesome in green, it shows off your eyes. Is it your favorite color? That human connection establishes a level of decreasing anxiety and trusting and building a relationship that I think is important, whether we do it virtually or in person.
Great. Thanks so much for that. And Amanda, I would just like to ask about your experience during Ava's physical exam. Can you tell us a little bit about what it was like for you to go through that process today?
One, I appreciated that she explained to me that she needed to see Ava's face to understand her reactions to what she was going to ask me to do. She made it very simple, explaining the stomach in quadrants like a tic-tac-toe board. She broke it down into language that I think anybody could understand. With that in mind, I think that any parent could do this. I would never want somebody to turn down a telehealth appointment because they didn't think they could facilitate what needed to be done for the examining physician.
Thanks for that. And just one more question, Amanda. What would you tell parents in a similar position as you were role playing today? If they had a question with their doctor that maybe in years past they would have made sure to go into the office to get examined, what would you tell parents to maximize telehealth?
I think that I would encourage them to step into getting more used to requesting and using telehealth. We're all busy. It's getting to a clinic, getting parked, getting kids in and out. It can be a lot, and it can take a whole afternoon or a whole day sometimes, depending on where you live. So as much as you can maximize telehealth as well as the relationship you have with your provider, I encourage that. But I agree with Dr. Kressly that relationships are important. Maybe don't go to your first visit telehealth, but once you establish that connection, I think you should take advantage of it as much as possible.
Thanks. Now we're nearing the end of our time together, but I want to give an opportunity to both of you to share one thing with either patients or clinicians, one real takeaway that they can implement into their next visit. And Dr. Kressly, we'll start with you.
Don't be afraid to be honest on both sides of the coin. We are fundamentally people who care and try to provide care and want to see care. And so being honest about, I'm sorry, I can't see you. Can we pick a different light? Or it seems like you're in Starbucks. Is that real? Are you safe being in Starbucks for this conversation? And it may be that it's the only place you have broadband, right? So let's let ourselves be people and be honest and share and share and be forgiving and give each other grace if it doesn't work exactly the way we plan.
I love that. Great takeaway for, I think, so many aspects of our lives. Amanda, do you have a takeaway for parents or clinicians today?
Yeah, the honesty and the human connection, and just even acknowledging that whatever dumpster fire is going on in my life that might slip into the camera is, something that I can be comfortable that, that it's okay, that my house doesn't have to look like your clinic exam room when I connect with you.
Well, and in your house, your dog's barking, but in my exam room, there's people screaming, getting vaccines next door. So I'm not sure that either of them is the perfect place to have an experience, but we do the best we can with what we have.
Right.
So
it's all relative and just trying to figure out how to operate best in this new normal. But with that, we'll conclude this video. I'd like to thank both Dr. Kressly and Amanda for joining us today and giving us that great demonstration, but also our partners who make this work possible. For more information on how to have successful telehealth appointments for your kids, please visit childneurologyfoundation.org/telehealth.